Hello, my name is Tanya McMillan, and I'm a BSN student at Indiana State University. And the topic of my presentation today will be opioids in patient care. Objectives. The objectives for this presentation are to define and identify opioids, to define naloxone or Narcan, to identify signs of an opioid overdose, to identify ethical nursing principles, and to indicate ethical principles in patient care technology. So please pause the slide and go to the pretest link below and take the quiz to see how much you know about the topic. What are opioids? Opioids are a prescribed medication by a physician to relieve moderate to severe pain, but they also can have serious risk and side effects with addictive properties. Examples of opioids are oxycodone, fentanyl, morphine, hydrocodone, methadone, and heroin, which is an illegal drug. What is naloxone? Naloxone, other known as Narcan, is a non-life-threatening medication designed to rapidly reverse opioid overdose. It is an opioid antagonist, meaning that it binds to opioid receptors and can reverse and block the agents of other opioids. It counteracts depression of the central nervous system and respiratory system, allowing an overdose victim to breathe normally. Signs of an opioid overdose. There are many signs of an opioid overdose to include depressed level of consciousness, respiratory depression or arrest, abnormal breathing, fast, slow, or irregular pulse, cold or clammy skin, cyanosis, which is bluish skin, markedly constricted pupils, meaning dilated if anoxic, which means without oxygen, brain injury has occurred. Deviations from normal temperature, like hypothermia or hypothermia. Passing out or an unresponsive loss of consciousness. Skin color changes, like pallor or bluish tint to skin if a respiratory depressant is used, or a ruddy or flushed skin tone after cardiovascular overstimulation. Accountability and ethics. As healthcare professionals, accountability goes hand in hand with ethical principles. Ethical principles in nursing are beneficence, providing beneficial care, autonomy, allowing individuals control of their lives, non-maleficence, to refrain from harm, and justice, providing fair and equal distribution of resources and responsibilities. It is ethically responsible for healthcare providers to empower clients and their families to move forward to be self-sufficient. Nursing attitudes and beliefs can cloud judgment and cause an impact in the quality of care given. It is imperative that nurses engage and know patients' needs in all areas of care. If not, the patient experience and patient safety and quality of care may be negatively impacted. Recognizing the signs and symptoms of a drug overdose and knowing the proper use of naloxone prepares nurses to effectively handle an opioid-related emergency. This knowledge supports the ability of nurses to teach patients and families about how to handle an overdose outside a hospital setting. Educating the patient and family with the development of realistic recovery plans for prevention relapse, relapse recovery, and having a recovery toolkit is all a part of accountability as a nurse. Healthcare providers are legally obligated to do no harm, allow patient autonomy, and make decisions in the best interest of the patient. Ethical principles and patient care technology. Currently, patient care technology has taken on many forms. When caring for patients, like individuals with addictions, medical information is stored in an electronic medical record or an EMR. This information can improve access to care, quality, coordination, and cost. It also can be intrusive if accessed without justification. This can be difficult for patients because their information is shared by many doctors, nurses, pharmacies, insurance companies, and so forth. Therefore, legal ramifications like HIPAA, which stands for the Health Insurance Portability and Accountability Act, are set in place to protect patient privacy and ensure patient information confidentiality. Safeguards like passwords and monitoring systems are put in place also to combat breaches in patient health information. Patient information should not be shared without the signed written consent of the patient. Forms of patient care technologies. There are many different types of patient care technologies to include electronic medical records or EMRs, mobile devices like cell phones, patient portals, e-visits, which consist of emails but they are only used for limited purposes, telehealth, social media outlets like Facebook, and the internet. Never post patient pictures or protected health information or PMI on social media websites. References. The information that I obtained for this presentation came from the AmericanAddictionCenters.org, the CDC.gov, nursingworld.org, which came from the Online Journal of Issues in Nursing, and Missouri Medicine, which originated from the Journal of the Missouri State Medical Association. Now at the end of the presentation, if you would, please take the post test to see exactly how much you've learned from my presentation. And thanks for watching.